Hi, friends, and welcome to Let's Talk About Healthcare, a podcast about the challenges and the opportunities, the good and the not so good, and the moments of joy found all across our healthcare system today. And remember, it's up to all of us to make healthcare work better for everyone, one day at a time. Welcome to the next episode of Let's Talk About Healthcare with ProviderTrust. My name is Dave. I'll be your host, and we have an incredible guest today joining us to talk about telehealth and the rapid expansion and adoption of that over the last decade. We are joined today by Dr. Mia Finkelston, who is a longtime family physician as well as a senior medical director at Amwell Medical Group. Mia has been practicing telehealth exclusively for the last 9 years. And so as part of the research that we've been doing on telehealth adoption in healthcare broadly, we felt it was really important to bring a perspective to you all as listeners on somebody who's been doing this for quite some time that may be able to shed some light on what it's been like, what it's like now, and what it could be like moving forward in healthcare. So without further ado, let's get into it. Dr. Mia, welcome to the podcast.
Thanks, David. Happy to be here.
Let's kick off with an easy one. Tell us a little bit about you, your background, sort of what you do for Amwell, your background practicing medicine, and sort of what does a day-to-day look like for you?
Yeah, it's really hard to believe, but I have been a family physician, board certified for almost 30 years. Wow. That's a hard one to say, but it's true. And the experience has just helped me to be even a better telemedicine physician, I think. But I can't imagine that when I graduated from residency, that if anyone asked me, do you see yourself doing telemedicine fully when you are, 30 years from now, I would probably laugh and say no. But I always have an open mind. So maybe it would have been in my model somehow. But this is really amazing to be here and to be able to say that I've done this for 9 years solely, as you pointed out. I did overlap with my brick and mortar initially. And at that time, if you can believe it, only 13 states allowed telemedicine to be used. So I've really seen the growth across the country to allow all states to have a telemedicine solution. And I'm licensed in about 30 states, just to give you a little perspective on how busy I can be when I'm working. People really are enjoying telemedicine, and even more so now, which I'm sure we'll talk about. When I joined Amwell, I was not burnt out as many physicians probably think I was. I really enjoyed my brick and mortar practice, but I think I was at a stage both in my career and in my personal life with kids who were starting to get out of the house, high school and above, that I thought a little more flexibility would be nice. And that's really what attracted me to it. I was definitely losing some of my geriatric patients in my office because I'm in a small town. They couldn't come in very easily. And they relied on, and by that, I mean, they relied on family members to bring them in after work. And sometimes I wasn't there because I was busy with my family. So I noticed that group of patients were having trouble coming in for care. And I started hearing about telemedicine. And I thought, wow, let's add this to the practice. I can call or see my patients through video at the end of the day or when it's convenient for them and family members, at least as a touch point, maybe not full care, but at least as a touch point. And I went to my office manager at the time and they were just not interested. In fact, they sort of laughed about the whole idea, which is funny in and of itself. But anyway, so that's really what prompted me to think about telemedicine. And then I joined Amwell and really the rest is history. I do sometimes cover for providers in my area when they go on vacations to see their patients for them in the office like once a week. And I will say when I leave, sometimes the office managers will say, okay, Dr. Mia, how many of those patients could you have seen virtually? And it's about 50%. Again, I'm seeing probably patients who aren't as acutely in need as it could be because their doctor's gone. But the point is, a lot of what we do, I think, in our brick and mortar practice as a primary care physician can be done through telemedicine. So, and just briefly with Amwell, when I sign into work, I see patients, and I told you about my licenses. So I am pretty busy. And then I also wear a medical director hat where I have been for, over 6 years now. And with that, what I love doing is outreach to providers. So I'm really involved in the mentoring, the training of new providers, the credentialing of providers, the quality control, really, reminding providers and counseling them a little bit if they're not practicing evidence-based medicine. And I'm a team player, so I try to help out wherever I can.
That's awesome. Thanks for taking us through all of that. Let's actually start with current day and maybe the last 12 months or so as we've all dealt with COVID-19 and the pandemic. Certainly, we're all aware telehealth adoption has just surged over the last 12, 18, 24 months, just like never before, just given all the restrictions on care as well as just ongoing patient fears about going back to a brick and mortar. I'm curious from your perspective as somebody who was already in the telehealth world well before COVID-19, when did you first start noticing this change? How long did it take? When I think of pandemic, I think back to March of 2020, right? Is that about when your world started to shift? How did that impact your world? When did you start to notice it?
I think the March, April timeframe was clearly when we saw the uptick in demand for care. And our numbers jumped in that second quarter, I think like 300% from the first quarter with Amwell in visits. But I have to say that back at the end of January and into February, internally, as the clinicians, we started meeting with a more regular cadence about clinical issues. I mean, we all saw it on the news that something was starting, right? We started hearing about this. And so internally, we already had started with a COVID-19 sort of force that would meet with updates. What can we do to our clinicians to keep them current? We all want to practice medicine similarly, right? And how do we educate, keep everyone on the same page? So I saw that internally. I would say the end of February, we really were in high gear with that. And then mid-March, the numbers started coming in. And it really was, I think in the beginning, a bit of, I don't want to say I was panicked, but I was definitely alarmed. You know, when I saw my waiting room numbers, I usually have patients waiting because, as I said, I have so many licenses, but just to see that increase and realize, wow, people either need care, they need education, they just need a hand to hold virtually, they just need a friendly face who can say it's going to be all right. So it was a moment of, wow, you know, this is really happening. And then you really didn't have time to panic. You just had to act. So I think internally, again, the physicians, we were all hands on deck. You know, I remember starting shifts earlier just to see if I could help out with a patient or two. I know I stayed on later and my colleagues did as well. We all were really doing our part and burning the midnight oil there, you know, to try to help out with that. And I think that March to April was really amazing to see that. Yeah.
And so now that we are in sort of mid-year 2021, how has that continued? How has that changed? Sort of what has that demand really looked like? And I'm asking for, in a lot of, we continue to see some research that a lot of patients and consumers now prefer telehealth that maybe didn't before. And so how has that sort of changed your world over time now that we may be out of the hectic side of the pandemic and rapid telehealth growth, but has it flatlined or has it decreased, or kind of what does that look like in your world?
Yeah, I like that question because I think for me, it is pretty constant. There definitely was a time where things dropped a little bit. If you think about last year, I guess it was late summer, things sort of dropped off with maybe how busy I felt when I was working and that need to, go on early, be on late, because people were starting to get back in maybe with their primary care physicians, or they just weren't going out, so they weren't sick and they didn't need care. But there were always those steady people who needed refills on medications, and sadly, their primary care physician is closed or maybe retired, But then as we got into the winter, some primary care physicians were opening again, if you remember. And so, I think that there was a little bit of a dip in that intensity. But then winter came and we started to get illnesses again. And people were like, okay, wait. Maybe we left too soon, let's stay home. And that's the beauty of it. They can call us from home. They don't need to go out and risk getting sick or spreading any germs that they may have. And so that brings us to current. It definitely has dropped off, I think, to some degree with that crucial, I need help, the sheer volume of people. But we are still busy. And I think for like this morning, I worked just for 2 hours. And I think out of the patients I saw, still 2 or 3 of them had upper respiratory illnesses. And we went through COVID questions. And we, 2 of them were vaccinated, 1 wasn't. And it was still every bit as much educating as I did last year. Those visits in the beginning, by the way, were also very long, which was added to a little bit of that tension. Our visits, which normally are, let's say 10, 15 minutes, we're probably getting closer to 30 minutes because of all the education you had to do. So we still have some of that now. It's just not as frequent, maybe 3 out of 10 patients will have that type of thing. And again, this is for the patients that I see. The rest are calling for the usual summer ailments now. I think I saw poison ivy this morning and urinary tract infections and a woman with a pink eye. So, we still see all of that bread and butter primary care, as well as people who are sick but are worried still about COVID and need education because maybe they don't have a vaccine. They want to hear, why should I get it, et cetera. So, that's sort of a good synopsis of the volume there. But people do want telemedicine. And I think that sometimes I'll hear when I ask patients, one of my questions is, do you have a primary care physician? And they'll say, yeah, I do. But, I thought that this was something you could help me with today. Or I try to call and they don't have any appointments until next week. Or I called and they're still out of the office and they're not sure when they're going to open. So the need is still there. And to your point, I think that there are some patients who tried telemedicine, had a successful visit, whether it was convenient or less expensive, or just did what they wanted and they liked the interaction from home, et cetera. They're still calling in. And sometimes we have to redirect them. We do train our providers that we're not a substitute for their primary care physician. And if they don't have a primary care physician, we want them to understand the value in that. And so I like to think that we all try to get people back in there. And even if they don't get in, tell your doctor that you're using telemedicine services and you're using Dr. Mia, bring a copy of your note, et cetera, to include them in there. I do want to say that there is sort of I do urgent care, but I think one surge and one constant need that we can't ignore, and you may bring it up later, but I'll say it now, is really behavioral health, mental health. That is something that I don't know. I think that we could predict it was going to be an issue during COVID, but the sheer need for care, the volume of patients with behavioral health issues, whether we created it with the COVID, pandemic, or we revealed it, who knows, probably a little bit of both, but the need is there. And I'll tell you firsthand that a lot of people who have had previously diagnosed anxiety or depression often were diagnosed and started treatment with their primary care physician. So they'll come into our urgent care platform looking for a family doctor or looking for an internist, as opposed to going to our parallel behavioral health platform, which we also have, which is super busy, and we're hiring all the time and credentialing providers. But they'll come in and they'll see me and they'll say, Dr. Mia, my anxiety is just not like it used to be. Or they'll be calling for another reason, and I'll say, hey, I see that you have anxiety, you're on this medicine. How's it been for you? Just taking that 10 seconds to ask patients, how are you coping with all of this? Speaks volumes. And I've had patients who burst into tears when I ask that. Remember, they're calling for something else, or they are just so grateful that, wow, you can help me with that. So we can't ignore that. And I think that even people who thought that they were really well controlled with anxiety or depression still are having some breakthrough and need touch points of medical care, therapy, which we can do all online. So behavioral health is definitely here to stay, times 10.
Yeah, I so appreciate that context, and just being able to listen to that from your perspective is fascinating. So thanks for being so thorough in that and just taking us through. Looking 40,000 feet for a second, over the last 18, 24 months, what's been some of the biggest benefits that we've seen to either individual patients or the healthcare system altogether with the increase in telehealth usage? What's been the biggest benefit, but also the biggest challenge that we continue to see across the healthcare ecosystem?
I think of that in two ways. I'm always thinking of patients first. That's just, I think, the way family doctors are in general. So from the patient's perspective, the obvious things, convenience, for whatever reason, whether they're afraid or they can't leave their home, they need advice, they can get it on their level. We're 24/7, so 7 days a week. So they can call at 2 a.m. or at 10 a.m. It really doesn't matter to get what they need. That's, number one. I think the comfort of their own home, their PCPs may be closed, all that. From the doctor's perspective, I think that is something that has facets to it. A lot of doctors who work, let's say, for themselves and in a small primary care practice that had high overhead. We tend to not make money in the brick and mortar when you're not with a health system. they had to close. They didn't have staffing because the staff didn't want to come in. Maybe staff was sick. Maybe the doctor was sick. So these doctors who now can't work in their brick and mortar still want to provide care, are still capable of providing care. Many of them, even if they were sick, they still wanted to provide care. So it was a benefit, I think, for doctors to realize, wow, I am still useful. I can still do what I love. I can still make some money too, that type of thing. And I think that's one thing worth mentioning, that the surge in doctors interested, raising their hand in getting credentialed with Amwell Medical Group to be able to provide services when they could using our technology was also huge. And I think that has been really rewarding for me, because side note, I mentioned it earlier, when I first told my peers in this small area that I live in that I was going to do this, they all kind of like smirked, they laughed. And now, lo and behold, my neighbors are calling me, hey, Mia, can you go ahead and give me like a little primer on website manner? And how do you, get a good lung exam, or like, how do you feel confident about doing an exam where you might not have all the vital signs that you're used to? And so it was really, I chuckled internally, but I was so grateful that here they are willing to learn. And some of them are continuing to practice with telemedicine in their brick and mortar, and they're making a hybrid model, which I think we'll talk about a little bit more later. So I think that's a huge benefit for the doctors. I think one of the challenges was that increased supply of patients that was coming in, and like I said, I could feel the heaviness of patients needing care, trying to get doctors onboarded and credentialed quickly. It's not a quick task typically, but with the groups that were working 24/7 within us, and I think that you know what I'm talking about personally from helping, we were able to do that, and really amazing. And I even had another side note. I had some medical school classmates who are across the country pinging me and saying, hey, Mia, I just saw your videos that you made on how to examine, the lungs, et cetera. So it just was interesting. The all hands on deck wasn't just within our group, but really was national, and we just needed doctors. So that was a big challenge, the turnaround. And one thing that I hadn't thought about, but I've been more appreciating lately, is the tech needs. I mean, I might not be using the right word, but I'm sure our tech teams had to get more servers in order to process all these visits going on at the same time in different areas. And I mean, how that happened, obviously that's beyond me, but really amazing, the different levels to make this such a smooth, seamless way to provide care to a patient. It really amazes me. And I'll say, I rarely have any tech difficulties. So that really is a testament to how quickly and how well Amwell worked during all this.
Yeah, that's super helpful. Thanks for sharing that. Even some of the stuff that we run into from a tech perspective is, making sure that these platforms are secure and HIPAA compliant, and making sure that every provider that is seeing a patient virtually is still properly credentialed and has the right license for the right state and all that kind of stuff as well. And so it's just the complexity in this it's high. It's a high complexity, and it makes it all the much more impressive to watch the growth and the scalability of certainly Amwell and other players just figure out how to do this. Not just grow quickly, but also do it in a scalable, sustainable, safe, compliant way as well. It's just something that I'm continually impressed by when I watch organizations do what y'all do.
Absolutely. And I think that, if you don't mind me just going forward with that, because you're on a roll with such great points, the future of telemedicine, this industry of telehealth in general, I think it has no boundaries right now. There are just so many possibilities. You just need the brain to think of it, and you need the manpower to put it into action in a responsible way. Absolutely.
Well said. So I want to ask maybe a different question about telehealth, maybe again at a 40,000 foot level, is did the surge in telehealth that you were able to observe highlight any gaps or disparities in our healthcare system, either for you personally or what you've been able to observe system-wide? And I'm just curious, the role from your perspective that telehealth plays in addressing some of these just disparities across our healthcare ecosystem today. What have you seen, and then what's the role moving forward?
I definitely have points, but I'm sure there are more people who could add to this conversation, at different levels. But I think what I noticed first and foremost, or what I've heard, let's start with that, is it's almost a criticism, is that, well, telemedicine is great, but not everybody has a smartphone or the capability to have a visit. So some of that disparity with regard to, rural populations, maybe less fortunate populations, we need to address how can we get into these areas. And I think broadband widths have improved incredibly over these last 9 years. So that's a good step. I know that there are a lot of creative people trying to get out into different areas to provide services and provide pop-up kiosks, et cetera. And what I saw on my end, not that I worked on this, but during the pandemic, I saw new relationships coming up, new clients coming up on platforms like Medicaid in New York and Medicare, all adding new platforms so that we could reach more members and get it covered. And I think that was huge. One thing that we did internally with Amwell Medical Group was to help the Fire Department of New York. We just overnight started this platform. A lot of it was phone-based and it was mostly triage. But again, it was another step to help those in need have a healthcare voice who could talk to them, whether, as I said, it was sending them in, calming them down, helping to navigate the healthcare system. So I think when the times get tough, right, you start to see where some of these holes are, and that would be a big one. And I know that regulations did change for reciprocity of medical licenses. Some of that is turning back. If it hasn't already, it's going to. So with licenses, that's a big one. As those may know, when I get a license in a different state, it's a different process for each state. So if we could have like one universal license that would cover you for every state, that would just be, amazing, because, it probably doesn't surprise you to hear, but, to get a license in one state, I might have to take some exams in certain topics. And for another state, I might have to go see them face to face or Zoom meet with them face to face and do a one-on-one interview. For some, they are interested in specific scores on things. So it really isn't universal. And that's a big challenge, and why I think a lot of providers don't want to be bothered with getting more licenses, because it's a lot of work. And if you don't have anyone filling out those forms for you, you've got to take time to do that. Plus it's money. So, and all the costs. I mean, you could $1,100 for 2 years to $200 for 2 years. So again, all the states are just so different that getting some universal licensing, I think, would really help that. And maybe different minds of my own are thinking of that right now. I can only hope. The other thing is for reimbursements. And I guess Medicare has extended through the end of 2021 reimbursements for some telemedicine visits in certain areas. I hope, fingers crossed, that we don't go back to not doing that. I don't think we can. You've heard that saying, once the toothpaste is out of the tube. I think we have to go forward, and let's hope we can think of creative ways to make that even more worthwhile, because that is a big reason that doctors don't adopt telemedicine right now, is they just don't see that there's adequate reimbursement yet for it. But patients want it. And so it's going to be that push from the patients and the clients or the members who are saying, I want this, for doctors then to think of creative ways to allow telemedicine services, and hopefully, regulations can help with that.
Absolutely. I think you touched on what I was going to ask next, which is just what are the major barriers that could stand in the way. And we see the licensure one, just from the nature of the work that we do at ProviderTrust. The licensure one is a big deal, especially as these emergency orders are starting to roll back. A lot of the challenge of license portability across states and the extensions on expirations and things like that are actually making what we see from our seat is a lot of providers actually fall out of compliance really quickly without knowing so, because of all the extensions from the primary sources and these licensing boards state over state, which adds another layer of complexity as well. So it's interesting. We see it from our perspective. You see it from yours, that the challenges of getting them on the front end because it's so complex. We see the challenge of keeping them on the back end because it's so complex. And certainly in the year 2020, every state managed public health emergencies and just expiration deadline extensions and all that kind of stuff so disparately that it's made it a challenge both in the front and the back.
Right. And just to add to that, I mean, providers have to do continuing education for each state. It's different. The amount of hours is different. Some require certain things, and they're adding this, it seems like every month there's a new requirement for certain states. And I'm not saying that that's bad by any means. We learn. But if there's a way we could try to make it more, universal and the same, it would be. Doctors are already working really hard, So, yeah, you don't want it to be a deterrent to provide care, which is the bottom line, providing care.
Absolutely. What does the future of telehealth look like from your perspective? I know that's a big question, but given the fact that you've been practicing exclusively for 9 years and you've been so involved in some of the most critical times of telehealth expansion over the past 2 years or so, what does the future look like for you?
I really believe that chronic care management is where we're going to move ahead with this. And this, to me, makes sense as a way that doctors who are already established in brick and mortar practices and health systems, they're going to be able to add it into their daily routine seamlessly. They're going to be able to see that hypertensive patient who they started on a medication, who has a home monitor that they know is calibrated. They're just going to be able to see them this way and say, any side effects, what have your readings been? Okay, great. I'll see you in 6 months in my office. So, and they're going to learn, those who aren't doing it yet are going to learn ways to marry the two together. I think just to throw a few other ideas out there, diabetes is a great one to do it. And I know of health systems across the country that are rolling out, if they haven't already, some diabetic management programs where you don't necessarily need to drag patients in. And I say drag because it is a drag, find a parking spot, take off from work, bring them into the office. Not as often, but you can still have frequent touch points, which, as we know, chronic illness, specifically diabetes, does need, and people do better with that. Again, I think we have to be careful about driving up costs, but I like to think that for some chronic diseases, you're actually going to minimize costs, because sometimes those high costs are because they didn't take their medications, they ended up in the ER, that sort of thing. High cholesterol and heart disease is another one that you can manage. And I personally think that post-op care, discharge planning, or discharge from the hospital to decrease readmission rates. And again, I don't know which hospital systems are doing this, but I'm sure there is some data out there, or beginning to become some data available looking at that. But I can't see how it wouldn't help decrease hospital readmission rates. You have the discharge planner, whether it's a nurse or a physician themselves, calling the next day, checking on the patient. There's just so much you can do with that. And so I think that is where we're going to see a lot of future uses of telehealth, is in our regular offices with chronic care management. I will also add, though, that I guess it was 3 years ago now, maybe 2, I went to the American Telemedicine Association meeting for the first time. And I was amazed when I walked into their big forum where they have all the people and companies that are working on new tech gadgets. And when I left, I thought, wow, the tech is like up here and we're just here using it. So I think as we learn more, and as the tech gets better too and more reliable, probably that's a problem. I mean, what we can do through a virtual visit is going to be so much more similar to what we do in the brick and mortar. I already think, for me, my visit in the brick and mortar versus virtually is relatively the same with respect to the questions I ask, the listening I do, the tests that I can order. It's a matter of laying hands on the patient, of course, that I'm missing. But there are devices now where you can listen to heart sounds and lung sounds, and patients can take their temperature and give you their weight. So we just all have to work together on this. And I think the future is very bright for telemedicine. Obviously, I'm a huge advocate of it, but I think that the trick is going to be, let's just make sure that it is cost effective, that we're not overusing our resources, there's a value in it, and that we can get it for everyone. Easy, right?
No problem. I so appreciate that perspective. As we move to wrap, I got a couple more questions for you. One is just what excites you most about the future of healthcare, maybe even beyond telehealth? It's clear that that's where your passion is, and it's so it's so refreshing and exciting to hear your vision for the future of telehealth. But beyond that, what excites you most about just healthcare in general?
Well, on a positive note, I think that there are a lot of negative things that we can sort of figure out, especially, healthcare coverage and things like that. I don't want to go down that road. I really am excited by the fact that, and I do mean this sincerely because I'm such an educator when I see patients in my office, is I get the impression now more than I did 10 years ago, maybe a little longer. People really are interested in their health for the most part. They want to understand why they get certain things, and they want to be preventative or proactive with recognizing it themselves and being able to do things to help prevent it from getting worse. At least that's how I approach every patient. I tell them, you have inflammation in your throat, let's do this to decrease it, things like that. And I feel positive about how people are more interested in their health than they were. I think we still have a ways to go, and we certainly need to get healthy food to everybody. And I don't want anyone to have food insecurity, which is, you hear about a lot right now, which is so sad. But I think overall, we're making great strides in making patients more accountable for their own health, as opposed to demanding the medical system to fix what's wrong with them. If I'm saying it correctly, you get what I'm saying? Just own it. Let's figure out what to do. I'm not the same as you. I'm not the same as the other person in the room. What's going on with Mia Finkelston here that I need to know about? And I think COVID brought that out too. People really needed to understand what was their individual risk for disease and what was the risk of the people around them. So I like that, and I'm happy that that's the way we're going.
Yeah, I appreciate that. If there's one thing you could change about healthcare, what would that one thing be?
I wish that there were. When I talk to someone who says to me, no, I don't have a primary care physician, I'm always healthy, and they're like in their 50s, and I could just start with preventative medicine. They've never had, a tetanus shot, they've never had their colonoscopy, et cetera. I just cringe with why, what happened that this person didn't, people have their own rights. I get that, but that's sort of frustrating to me. And then also people who abuse their bodies and, addiction, which obviously is so many layers and issue, but we all need to be aware of it, just self-destructive behaviors really make me saddened and hope we could find a way to do a better job. And all the stuff that happens in the news that we hear about with shootings at random and all that, I just, not that there is going to be one right answer, but I think the more that we all think about that and what we can do individually, I think that's what's going to help turn things around.
Yeah, I appreciate you saying that. Last question for you, and I also want to say, Mia, this has been incredible just to sit back and listen to you and learn from your perspective, but also just get excited by your vision for the future as well. It's just I'm so grateful you chose to spend the time with us today.
Yeah, I'm happy to be here. I love talking in general, but I really love talking about telemedicine. I've really it energizes me, and it makes me happy. What can I say? It sounds corny, but it's true. No. I like going to work.
It's amazing. It's amazing. The last question for you today is just what are you reading? What's on your bookshelf?
Well, I am reading a sort of, beach chick flicky type of book right now, beach read. I even forget the title, but it's a sequel to something I read last summer. So that's fun. But I'm also reading at the same time, which I don't usually do, but I've made it a goal in 2021 to read some more nonfiction books that can really help me. And I do have my own insecurities. One is with taking standardized exams. I'm not very good at it. And in December, I have to reboard. So I'm reading Mindset, which I think most people at some point have read, I think, just to make sure that anytime I have a negative thought about I can't do this or I'm going to fail or something, I can turn it around. And so I'm really absorbing as much as I can.
I love that. I absolutely love that. Thanks for sharing. Mia, this has been amazing. Thank you so much for spending the time. For those listening in, please make sure to check out certainly Dr. Mia's work, some of the things that she's been sharing, and just Amwell in general and the growth that they've been experiencing and the value that they're continuing to deliver across our healthcare ecosystem. It's an amazing story during a time where we all just needed it most. And so if you're listening in, please give them a follow or engage with some of the stuff that they've been putting out over the last 12 months. I know we at ProviderTrust continue to learn from it. But Mia, thanks so much for spending the time. This has been incredible.
Thanks, David. So glad to be here.
Thanks for listening to this episode of Let's Talk About Healthcare. Remember, It's up to all of us to make healthcare work better for everyone, one day at a time. Catch you next time.